You might think it's just stress, a bad night's sleep, or that time of the month. But what if those symptoms you're brushing off are actually your body's early warning signs of ovarian cancer? Hi, I'm Dr. Mikki from the Health and Wellness team at Ubie Health. As the AI face of Ubie's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, let's talk about 6 signs of ovarian cancer that are easy to miss, but can make all the difference if you catch them early. Let's start with a big one: persistent bloating. A little gas after a heavy meal is normal, but if your belly feels swollen and tight for weeks with no clear cause, pay attention. One of my patients, let's call her Maria, thought she just had a sensitive stomach. But when her jeans stopped fitting and she felt pressure in her lower abdomen every morning, we ran some tests. It turned out to be ascites, fluid buildup in the abdomen, often caused by inflammation from growing ovarian tumors. If your bloating lasts more than a couple of weeks, talk to your doctor. Next up, irregular menstrual cycles. Your period shifting once in a while? Totally normal. But if your flow changes drastically, comes twice a month, or disappears altogether, especially if you haven't hit menopause, take it seriously. A major study found that women with irregular periods had nearly triple the risk of developing ovarian cancer by age 77. That's because some hormonal imbalances can fuel tumor growth. If your cycle's been off for more than 3 months, don't wait, get checked. Now, let's talk about pain during sex. This one's tough and often ignored out of embarrassment. But here's the truth: sex shouldn't hurt, especially not deep in your pelvis. One young woman I spoke with had been silently dealing with pain during intimacy for months. She thought it was just stress or dryness, but that pain turned out to be her only early symptom of ovarian cancer. Tumors can press on pelvic nerves, causing discomfort during penetration. If this is happening to you, please don't suffer in silence. Speak to your provider. Then there's fatigue. And no, not just "I didn't sleep well, tired." This is a kind of deep exhaustion that doesn't improve with rest. Women with ovarian cancer often describe waking up tired, foggy, and unable to make it through the day. Cancer-related fatigue is caused by the inflammation and metabolic changes linked to tumor activity. If you're constantly drained for weeks with no clear reason, especially alongside other symptoms, it's time for a closer look. Let's move down, literally, to pain in the leg or thigh. Sound unrelated? You'd be surprised. As tumors grow, they can press on nerves and vessels in the pelvis, leading to a dull, persistent ache, cramping, or even weakness in your limbs. One case I remember vividly involved a woman misdiagnosed with sciatica for months. Only later did we find a large ovarian mass pressing on her nervous system. If leg or thigh pain feels unusual, doesn't improve, and is accompanied by abdominal symptoms, don't ignore it. Last but not least, urinary changes. More frequent trips to the bathroom, feeling like you can't empty your bladder, or sudden urgency are all symptoms that are easy to dismiss. But these can be early signs of a tumor pressing on the bladder. One of my patients thought she had recurring UTIs, but urine tests kept coming back normal. Eventually, a pelvic ultrasound revealed an ovarian growth. If these bladder changes persist for more than a few weeks, get evaluated. At Ubie Health, we believe your body whispers before it shouts. These symptoms might seem minor, but they're often the first clues. Early detection saves lives, and information like this can be life-changing. Worried about your own health? Start by checking in with a Ubie symptom checker at ubiehealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from Ubie Health.